everyone. My name is Dr. Andy Blauvelt. I'm a dermatologist from Annapolis, Maryland. We're here at the AAD 2026 in Denver, Colorado, and yesterday I presented a late breaker talk on the phase 3 data for a new drug in psoriasis called envudeucitinib. We say it's a long name, it's hard to say, so we abbreviate envudeucitinib by saying ENVU, E-N-V-U. So ENVU is a new TYK2 inhibitor, a next generation or second generation TYK2 inhibitor, and the company that is making it is called Alumis. So actually last year at this meeting, I presented phase 2 long-term data for envudeucitinib, and this year I presented the phase 3 data. So the data came from 2 studies called Onward 1 and Onward 2. They were identical studies. I presented week 24 data, and the studies compared envu with placebo and with apremilast. And what we showed was that envudeucitinib, or envu, beat placebo, of course, but beat apremilast as well at week 16 and at week 24. The interesting thing for me is the efficacy results were actually much better than our first TYK2 inhibitor, deucravacitinib, or Sotyktu. So in the US, we've had a TYK2 inhibitor for a while now, several years. And so what Alumis did is spend lots of time on developing a new generation TYK2 that worked better than deucravacitinib. So the design of the drug was supposed to be better, and that's what they have shown now, much better results from the first TYK2 inhibitor. So very exciting time. It's also possible, and there's people talking about it now, that the new drug will be even safer than the original TYK2 inhibitor. Again, it's related to the design of the drug. So as far as details go, the main detail I want to emphasize with this drug and from the data is the PASI 100 rates. So complete clearance, PASI 100, we saw envu group go to 40% PASI 100 at week 24, which is very high PASI 100 rate. It actually is similar to many biologics, and so that's exciting, an oral drug with similar PASI 100 rates to many biologics. And then we also have a new drug called icotrokinra, and we found, and many people are saying, oh, it's a great new drug, efficacy, safety, convenience, but in my view, envu is very comparable. I would say comparable results to icotrokinra in terms of efficacy, safety, and convenience. So now we have several new oral drugs for psoriasis that for the first time, in my view, are competing with biologics. So in the past, what's the best drugs for psoriasis? Biologics, IL-23 inhibitors, IL-17 inhibitors. Now we have some oral drugs that are in the competition, maybe not quite as good as the best biologics, but better than many biologics. So it's in the same neighborhood. We're in the same area now. And so for patients who want a pill instead of a shot, envudeucitinib would be very attractive. Now, when will it be approved? So in the US, it probably will be next year sometime. So this new drug that I just spoke about is not FDA approved, it's not approved in the US, but we expect that to happen next year. What I didn't mention, I'll mention now, is that in the same late breaker session yesterday, there was also another TYK2 inhibitor with late breaking results, phase 3 results, called zasocitinib, Z-A-S-O. Zasocitinib, or Zazo, is made by Takeda, and it has the same story as envu, the same story. They wanted to make a better TYK2 inhibitor, so they spent lots of time in the laboratory and focused on making it better. And the result was revealed yesterday, was very similar to what I just said for envudeucitinib. Great efficacy, great safety, a pill. And so now I think we have, as of today, and I want to say to the viewers, a new dawn, a new beginning for TYK2 inhibitors. That we started with one, but we've gone now to another level of efficacy. Maybe the drugs will even be safer. There's debate. We will know over time if the two new drugs are safer, but some of us believe that they will also be safer than the original drug. So better efficacy, better safety, and competitors with biologics for the treatment of psoriasis. So patients who want pills and they don't want shots, these will be excellent choices in the future. I've been involved with another company working in psoriasis called Oruka, O-R-U-K-A. And Oruka has two drugs in development that are very exciting because their hypothesis was, let's take the best drugs in psoriasis. Let's take risankizumab or Skyrizi, and let's take bimekizumab or Bimzelx. Let's take the two best drugs and make them better. That's what Oruka has done. So the first drug they made is called ORCA-001. And ORCA-001 is Skyrizi-like. Not Skyrizi, but similar to Skyrizi. The difference, though, is they have made it a long half-life drug. So ORCA-001, we know from EADV meeting, it's 100-day half-life. Very long-acting drug. And that drug is in phase 2 development. The next drug they made was ORCA-002. And we have a poster at this meeting showing the characteristics of that drug and highlighting the half-life of that drug, which is also very long, about 80-day half-life for the Bimzelx-like drug. So not Bimzelx, but very similar, but a long half-life. And so to me, very exciting because patients love fewer shots. If you ask patients now who are doing great with psoriasis drugs about their treatment, they say, always say, do I have to keep, I'm clear, I'm great, am I cured? Do I have to keep doing the shots? So it's a common conversation is for patients to ask about continuation of the drug, or can I do fewer shots? And it's happening now in private practice. We see more and more patients spreading out their shots. So the idea of Oruka, from the beginning of treatment, have fewer shots, I think will be very popular for patients.